Hi, I'm Todd Alonso. I'm an Associate Professor of Pediatrics at the Barbara Davis Center for Diabetes, and I'd like to talk a little bit today to some of our families about some of the questions we've had about type 1 diabetes and COVID. Information is really evolving quickly, and there's a lot of questions that are really on the mind of everybody. And the first one is, can I send my child back to school in the fall? Of course, I'll preface this for the fact that this is July 22nd right now when we're recording this, and I don't know where we're going to be a month from now when most of our schools are scheduled to start. But the question that you ask about children going to school really is the question that every parent in the U.S. is asking about their children with or without diabetes. And I'm really glad to see a lot of our school districts doing everything they can to work with local and state officials to come up with really safe reopening plans. And I know a lot of schools like Denver Public Schools, where my kids are at, are going to start at least the first 2 weeks online. Starts are delayed a little bit, and I really hope that when we get back in person that it'll be a really safe plan for our kids. But specifically for type 1 diabetes, we know that diabetes has been identified as a risk factor for poor outcomes with COVID. Most of that early data came from China, where the type 1 diabetes rate is really low, about 10% of what we see in the US. And most of that data really revolves around adults. So most of those patients have type 2 diabetes, and we really can't gain insights about pediatric type 1 outcomes. There's been a few other published studies, one from France, where we know that there were a very small number of patients under age 50 that were considered young among the type 1 diabetes cohort. Again, really hard to get conclusions out of that, but what we have seen in the US population is that the number one risk for kids with diabetes and COVID has been diabetic ketoacidosis. In all of those cases that we've collected so far, there's nearly 30 in our current registry, those patients had last A1C above 9%. So what I've been telling my patients in clinic is those of you with A1C at or near goal, your risk of poor outcomes from COVID appears to be very close to the rest of the population risk. And then when we look specifically in patients with higher A1C, I think the biggest risk is high blood sugar, high ketones, and so now's a really good time to buckle down on sick day management. If you look in your portal at the Barbara Davis Center, there's a sick day action plan that should be there. If you don't have one of those, please notify your nurse and we can get one of those to you. But being really good at managing blood sugars and troubleshooting on those sick days and being really quick to clear those ketones and get those sugars down is really important for your kids. So as far as return to school, I think as we see the evidence evolves and as we look at the community rate of COVID, we really don't know what the spread's going to look like in our schools. I think it's going to really depend on a lot of those factors that are going to be changing. And so it's going to be a really individual decision for your family and your community. So the second question that a lot of families have been asking is, what do I do if I think my child has COVID, or if we think a family member has COVID? At the Barbara Davis Center, we don't do COVID testing, so your best option would be to contact your primary care provider and get a molecular test. That's the nasal swab test. Turnaround times for those really vary depending on where you get it done. So I would ask about that if I were calling, what the turnaround time looks like. I know there's some free testing like at the Pepsi Center, and the turnaround time has been quite a bit slower there than it has, for example, at places like UC Health. So checking on that and really understanding when you're going to get the results back. But in the meantime, if you think you have COVID, or if you think a family member may have COVID, it's really important for your family to socially distance even better than you have been at this point, because we really want to prevent community spread of this virus. So wearing the mask when you're out, washing your hands, and staying home as much as possible are still really good advice. So the third question that we've had from a lot of families is, can our family travel? And I think that as we look at guidance from local and state health authorities, we know that there's a lot of COVID outbreaks in certain hotspots across the U.S. But I think more importantly is not just the location you may think about traveling to, but what type of venue are you traveling to? The decision that our family made months ago, and that's with a generally healthy family and no diabetes in our household, but we decided a long time ago that we would not be attending any public buildings without masks on and inside any public places where other people weren't wearing masks as well. So that includes like trips to the grocery store or the hardware store. And so I think that's really good advice, and I'm glad to see that the masking advice has come a little more strongly from our health officials, because there's really good scientific evidence that's emerging that masking really does reduce the transmission of this virus. And so I think good general advice as far as travel would be to try to stay away from hot spots, to try to stay away from venues where COVID spread. Places like indoors and no masking would be really high risk spread. And then travel as far as you can on a tank of gas. That's other advice that I've heard, and it's a pretty good idea as well. I'm glad that we have a lot of places that we can go, and especially like visiting the mountains here in Colorado that aren't too far away. But there's also really good guidance. I would also point you to the CDC's website where they have a little more in-depth guidance, and of course as things evolve, it's a really good source of information. So the fourth question that we've heard quite often is, when a coronavirus vaccine is approved in the United States, will you recommend this to your patients, and would you recommend this to your family? And I can say unequivocally, I trust the process of vaccine science and how vaccines are approved and brought to market, and when those things are approved, I trust that they're very safe. The science behind this and the way vaccines are brought out is the same type of science and the same process for everything that we do as a scientist, and all the science that we use to treat your child with diabetes. And so I'm really enthusiastic about the fact that there are a lot of vaccine candidates, and I think most likely we'll see several vaccines. It looks like maybe the earliest would be fall, or more likely maybe this winter. But I really do look forward to the time when I can recommend this for my family and for my patients.